I don't think they're confusing at all.
It's confusing. That's it.
Public health messaging on COVID-19 has resonated differently with Canadians. Any message that you think was clear?
Not at all.
I find the message very clear.
We got all kinds of vaccines and we're still being shut down, so.
And most of it's common sense, you know.
It's real-time science.
I think it is a little bit confusing. I want more information.
If you keep up to date, it is not confusing.
Canadians appear divided. But the Director of Communications for Ontario's COVID-19 Science Advisory Table says they're really not.
We're on the same page about the ways to interrupt transmission. We're really not fighting over vaccines. It's incredible when you compare us to all sorts of other countries in the world, not just the United States.
Not so much the same thoughts shared by the director of Ryerson's Healthcare User Experience Lab.
The assumption was that the vaccination was going to be some sort of get-out-of-jail-free card.
Jessica Moody says with the double vax still getting infected during Omicron, many are left questioning vaccines.
We did not ever, as a public health message, explain to people what this virus is, what it looks like, how it acts in the body.
A missed opportunity, says Moody. Public health could have explained the science behind viral mutations and based modeling on an expectation that, yes, people will gather during holidays. Get your booster shot, yeah! Well, whether the message is loud or whether we've heard it many times, experts say it could be misconstrued, even lead to false info if it's not used in the proper context.
Many of the provinces are reporting hospitalization and ICU rates by vaccination status, but they're doing it in a way that's very misleading. It doesn't have a population adjustment. So it actually looks like there are more vaccinated people in the hospital. It's a big tactic that disinformers are using. So I recommend people look at the Ontario Science Tables dashboard instead.
Meanwhile, on the Omicron front,
the one thing I hope that we keep is an understanding that when our advice changes, it's not that we were hiding something before. It's that we're learning.
Noor Ibrahim, Global News.